Good afternoon, everyone, and welcome to the COVID-19 Preparedness webinar series by the Max Institute of Healthcare Management. Today, we are going to be talking about, Vikram is going to be talking about how to set up teleconsulting and its best practices. I am Soumya Shashidhara, the Associate Director of the Institute and host of the series. Thank you so much, Vikram, for offering your time and expertise. Mr. Vikram Taplu is the Chief Executive Officer of the Telehealth and Government Businesses at the Apollo Hospitals Group. He's also the alumnus of the ISB Advanced Management Program for Healthcare class of 2018. Previously, we had a session on teleconsulting, and we had a lot of queries about how to go about the practical aspects of setting up teleconsulting for one's own hospital or even private clinics. And then Vikram was generous enough to offer his time and expertise. Before I start off with his session about taking you through the various aspects of setting up teleconsulting, I would just like to go over to Vikram and ask what's happening at the telehealth business at Apollo. Vikram, welcome to the session, and then can you take a few minutes to take us through what is happening at Apollo Telehealth? What has been some of your challenges previously, and what are the new trends that you're seeing post-lockdown, where hospital services are absolutely not available in the traditional sense of having to go to a physical hospital for treatments? Vikram, over to you.
Thank you, Soumya, and thank you to ISB for inviting me to the session. And thank you, everybody, for making time to join this session. I think it should be useful for you to understand more about telehealth. So, Soumya, back to your question. I would first say that, it may not be a right statement, but I think COVID has worked as a chief transformation officer for digital health. We have seen close to 500% increase in the uptake of teleconsults. People who have just got locked down at home have used the chatbots, have used the bots for understanding, have their COVID conditions. We have already more than 1 million people who have taken COVID test on our app. So I think people have understood that telehealth is here to stay. I think it's a turning point for telehealth, what's happened globally, with close to 3.2 million people having contacted COVID and all the countries on a lockdown. So this is, I think, the right time. The silver lining to this dark cloud is telehealth. So what are the levelers? I think what we understood that, first of all, doctors have understood that this is not a competitive issue, it's an enabler. So earlier, I think there were some concerns with the doctors that telehealth might take out their practice, it may bring down their numbers. But now I think at this time when their OPDs are closed, this is the only way they could reach out to patients. I think we are seeing patients abroad. Our doctors are seeing patients. If doctor is sitting in Hyderabad, they're seeing patients from Assam. So these things have actually helped. And I would also say that since doctors got a lot of time to take a pause, some of the doctor specialists definitely took a pause during this time. They took time to learn. So I think learning how to use these digital platforms was also probably a time constraint, which was kind of taken out during this time. And we have almost 800 odd doctors got onboarded during these last 4 or 5 weeks within the group system.
So I think it is very important for the whole industry to take a pause and rethink about how things are happening. And you talked about some of the levelers, like doctors coming on board and things like that. So, how do you expect this to carry forward? Is it going to be like going back to the default habits, or are you going to see some continuation of the trends? And then more importantly, I think what I would think some of the participants would be interested in knowing is how do you ensure that we sustain this by setting up an enabling environment within their own healthcare delivery ecosystem? So, Vikram, if you can take on.
I think there would be a little bit drop from where it is today, because everybody would try and go back to their life. That's human nature. But we will see a lot of things will stay. It's just a curve which will come up again, a graph which will go up again. The guidelines which are issued by the government are here to stay. Some of the amendments are right now in progress, and I think we will see an amendment to the guidelines soon after this pandemic is over. So what that's from a legal standpoint, we have got some good things done for telehealth in India. From a doctor's standpoint, when the doctors have learned how to use it and how convenient it is to use, I'm not expecting them to completely drop it. Uh, in integrated systems, this is the schedulers of telehealth are integrated with their regular schedules. So it's like they are sitting in their office, they are visiting patient A, the patient A and B is visiting physically, and patient C is visiting virtually. Doctor slots are not getting wasted. So that way, I expect a doctor would not let it go now, having understood how it is useful. For patients, this has been great. My father has been visiting his doctor virtually over the last 4 weeks. So he has understood earlier for him it was convenience to get into a car and drive to the hospital, but now he felt it's much more easier to just click on his mobile phone and from his room consult a doctor. So I don't think patients will also 100% leave it. There might be a little dip, but it will go up again and it will be better than what it is today. That's what we understand or what we expect. And during this time, all the people involved with it, whether it is a business transformation officer, whether it is a technology officer, when the usage goes high, the product becomes much more user friendly because people understand where the glitches are. So those glitches have been removed. Every platform owner has today removed more or less every glitch which they faced. Software engineers have been working from home, so I think there was no drop in that. They have been given what are the changes to be done in the platforms, and they have done the changes. Testing have happened, certifications of the platforms have happened during this time. Government has been very forthcoming by extending the norms and making sure that work from home doesn't suffer. So that way, I'm seeing all of these factors have contributed. This will stay.
Thanks. That's a good backgrounder. And then I now hand over the session to you to start with the practitioner masterclass.
Sure, Soumya. Thank you. Let me know when you see the slide.
Yes, I'll confirm that. Yes.
Are you able to see? Great.
Yes, you can see this slide, Vikram.
Yeah, great. So thank you everybody for being here. I have tried to keep this slide simple, given that we have a varied group of people on this call. We have doctors, we have engineers, we have hospital administrators, we have business development officials, and we have other functionaries also. So given that background, I'll try to kind of briefly impart some knowledge from a telehealth practitioner's viewpoint. So as you can see on the slide, it's a very simple thing. What's teleconsult? Teleconsults is a very simple process of shifting point of care from a doctor office or a hospital using technology to where a patient is. The patient can take this call from home, from office, or from anywhere they want. It has apparently few benefits. Beyond these apparent benefits, there are a lot other clinical benefits to telehealth, but here patient has comfort of home, they avoid queues, they avoid time travel, they avoid hospital visits, it's cost effective, and it's easy to use. But behind this teleconsult is a whole gambit of a digital health platform. Now, digital platform is as simple as it can be a plain EMR integrated with social media, mHealth and eHealth embedded, to making it much more interesting with gamification, and as we can say that it can be supported by sensors, wearables, IoT, IoMT devices, connected health devices, making it much more comprehensive. As you can see, what we understand, there's a better quality, patient outcomes are better, patient engagement is better. Adherence to clinical guidelines is high since it's all automated. Better information flow is there. You have increased affordability. Using these platforms, the speed and care, the speed in providing care and scalability is there. The clinical pathways, since they are automated, ensure that there's a uniform care and there's improved access. Now comes the COVID-19, and this has changed a lot of things. As I just said, this has worked as a chief transformation officer, and that's why virtual hospitals make sense. And we believe telemedicine is the right way to deliver healthcare. Now, taking you quickly to what is the technology behind teleconsults, it's very simple and it can become very complex. So, we will start with very simple. So, we need to have a bandwidth or a broadband which connects the data from one place to another. So, doctor should be able to connect to a patient. It can also include Wi-Fi's, it can include Bluetooth because some devices have to speak to the EMR or the device or the laptop or the iPad simply. So there has to be hardware and there has to be a software which transmits this. And here we look at who are the providers, the stakeholders within this. In different use cases, different people get involved, but doctor stays at the middle of it. In some cases, a nurse or a paramedic is also involved who do the basic triaging, take vitals and take details at the far end, and the doctor receives it at another end. Lab technicians are involved in some cases to do the tests and to upload into EMR, or even if there is point of care diagnostics done by the patient. Then telemedicine assistants are also involved somewhere. And there's another complete list of other staff who are involved in this to do other courses around the ensuring a proper consultation. Doctor, as we already know, have to do their clinical judgment while doing the teleconsult. Now, this was one of the main points which has been raised many a times. What are the critical issues which are to be addressed? We believe, first of all, doctor onboarding is very important. So workflow for utilization of telemedicine platform has to be made sure that is as per what is required. Training of healthcare professionals is required. We have to ensure continued usage of platforms there so the doctors get very well used to it. And doctors have to be protected against any medical legal issues. So we have to completely talk about the guidelines, and the software should adhere to the guidelines, and the doctor or a healthcare provider should be safe. So maintaining quality is very important here. So in quality, we look at assessment and evaluation of all teleconsults. Interestingly, all the teleconsults are recorded and they can be audited anytime. Doctors do get feedback on that, and it also helps as a training tool. This is what we do internally here at Apollo. So doctors, what training they need is also assessed through their recorded teleconsults. Training methodologies for clinical quality are maintained through this. Risk mitigation procedures are used. Designing and monitoring of key performance indicators. This is very important from a business standpoint as well as a doctor standpoint. If the KPIs are designed and monitored well, the quality remains better. From a technology standpoint now, implementing enterprise-wide information security protocols is very important, and which helps us adhere to patient data privacy. Building in redundancy is very important. I think we all understood during the COVID lockdown how redundancies, who the people and businesses who had built redundancy, how they were able to stay afloat and without much impact on their businesses. And periodical maintenance of this infrastructure is very important. So digital health platform, from our view, is basically, if you look at the digital health platform, it has the yellow dots, which is a payer, provider, and a patient. These are the stakeholders, and rest of them are all modules. So if you look at the payer, it can be a self-paying module, it can be a corporate paying module, it can be a government paid, it can be CSR sponsored. Insurance is still being worked on. In India, teleconsults are not yet covered by insurance, but globally, I think many countries have already started doing that. And on the provider side, we know the point of presence is how where all we can have them, how we can be online, how this can be connected to home care, how it is connected to a BPO or a contact center where from patient can be supported to just take these services. And from patient side, it's how to discover the platform, make inquiry, book consultation, do follow-ups, maybe require, if you require home care, do that, and EMR management here. If you look at today in the market scenario in India, we have many players who are present with their platforms. So any of them, whichever suits users, can be used. For example, I'll give you a little more detail about what we have. We have 2 or 3 platforms depending on the use cases. But here I have popped up Ask Apollo for you. So this particular thing is on an app and can be also accessed through web. You, patient can take consult, patient can order medicine, patient can order diagnostic, patient can book an appointment, find a local nearest Apollo. In case of emergency, call for emergency services, and continuously get health tips, and can manage the entire family health through this one app. There are similar other platforms available. In a B2C market, we started another product called Apollo 24/7. That's also very similar to this, and that's the future for that is to be a marketplace and can be used by doctors. Choosing the right platform, a very important thing. While as the current guidelines have made it very, very simple, we can actually use WhatsApp for consult, but then the concern remains, can the consult be saved? Can we later on look at it? Can we do audits? All that will be always a concern. But so when we are kind of trying to choose a right platform, we have to choose a platform which is compliant with certain guidelines. It may be a legal requirement or may not be a legal requirement, but it's always good to find platforms which are compliant with HIPAA, ICD, SNOMED, and EHR guidelines. They should be built up with adaptable technology so that they can integrate easily with devices and platforms. For example, if you have a hospital management system, it should be able to integrate with it. Or if you have a clinic management system, it should be able to integrate with it. Or any devices which you are using in your clinics, or devices which a patient may be using, it should be able to integrate quickly. Very important, it should be using less bandwidth. It should utilize low storage. From a clinical standpoint, standard treatment guidelines are very much should be embedded so that triaging can be done. Clinical decision support system should be embedded so doctors can give a quick and uniform services. And it's always better if this platform can do suggestive symptoms during case sheet filing. So patient does not have to really look at the jargons, medical jargons, and can easily look at what it is. If possible, if it can give geography-wise suggestion on medication during prescription writing for the doctor, it makes life easier for a doctor. From a user standpoint, it should be single window use. Access should be easy, yet it should be secure. From a doctor standpoint, the dashboard should be there so that the billing and reconciliation can happen. And in case we want to do data analysis, that should be possible through this platform. So these are basically what I would suggest for if we are trying to search for a right platform to use. Now, here you look at it, we have a value chain through which the augmented teleconsults can be given, connected health devices can be integrated, actually are part of it, integrated platforms, as I already said, comprehensive diagnostic services, pathology, radiology, all that, health counseling and health coaching, pharmacy management tools, and if it is on mobile, it's more comfortable for use by patients now. And there should be a learning environment or an LMS or something which will help patient, doctor, everybody to get more knowledgeable on this healthcare. So this is basically the value chain of the entire platforms. And using these platforms, what we have been able to deliver as programs and services are teleclinics, which are nothing but doctor clinics converted into digital health clinics. We have delivered tele-emergency, remote parts of the country where people have not been having access to emergency services. We have activated that. There are multiple videos available on YouTube done by Apollo Telehealth. You can find time and see. Gives you much more detailed view of what it is. Digital dispensaries have been, kind of converted. These PHCs or subcenters have been converted into digital dispensaries. Teleradiology is very easy, everybody understands. Telecardiology, again, very easy to do. Teleophthalmology, need of the hour. We run a very huge project in Andhra Pradesh on teleophthalmology. So this is also a need of the hour. Teleaudiology, one of the ignored fields, but very important. Condition management, as we understand that NCDs are trouble, and it's most of the population is affected by one or the other condition. So condition management through digital is one of the best ways to reach out to patients. NCD screening, now, as I probably said somewhere, future is going to be contactless, and we have to look at tele NCD screenings. Uh, so we have been doing NCD screenings for the BPL population for as Apollo Telehealth, and in through our PHCs, we have done NCD screenings, but we have to look at methodologies how NCD screening can be done completely remotely. Smart health kiosks, these are both manned and unmanned. They are very helpful. As I said, unmanned kiosks are the one which is going to get more traction in future after this COVID. Tele ICU, I think most of us understand. ICUs are very, very important part of a hospital system, and the intensivists who man them are very less in number. So first of all, to increase the reach of an intensivist, tele ICU makes sense. And to ensure that in smaller towns, intensivists are available, this makes sense. So we already run a hub with 500 bed capacity here in Hyderabad, which is tele ICU. And tele education is also very important because ultimately, that, as I said earlier, also learning management system for both provider and user are very important. So we here understand the future is the connected health, and connected health definitely is mostly remote health. So point of care testing devices which support remote diagnostics today, clinical decision support systems and clinical triaging systems which actually help doctors provide standard treatments. Machine learning and artificial intelligence, as we understand, is is the talk of the town today. And this data is used to create much more smarter bots. Sensors, personal care devices, wearables, these are the devices which help us from illness to illness. Health analytics and business intelligence tools, which are part of these, are used. And health information exchange. This is basically when multiple platforms are there. So health information exchange can help seamless and secure data flow from one system to another system. So as we understand, life after lockdown will be very different. The BC era, which we used to earlier know as a different name, would be now before COVID era, and things will be would be different after the disease is over. DC era is today. That's why I think everybody is using this time to think differently, and they are planning how to handle the AD era. And AD era, as we understand, is going to be the after COVID disease. Many things would have changed. We will change the way we do things. All of us would be different people working things differently. Thank you. This is quick, and I think we can go into details here onwards. Over to you, Soumya.
Thank you, Vikram. I think you can stop sharing the screen then.
I did stop.
Oh, cool. This is fine. So it was very interesting when I was like reading a little bit about the Apollo Tele as a run up to this session. I saw that Apollo does not only run their own platforms, but they're also available on third party platforms. So, what is the idea behind this approach that any hospital is taking?
So basically, I would like to keep it simple, more the merrier. So each of these platforms are nothing but from a different view. If you look at their funnels, they are channels to reach out to patients. So that's how even Apollo doctors and Apollo hospitals are available on other platforms.
So you basically telehealth is more like a means to an end where able to like use it as a medium to channel various ways of doctors interacting with their patients and then also bringing them on to hospitals for other requirements where they are supposed to be physically available and to be in person contact with the hospital. Would that be a right approach towards it, Vikram?
Certainly, Soumya, it is means to an end. Uh, Telehealth is not a specialty, it's just a method of delivering services. And as we understand, as we go forward, hospitals and tertiary care hospitals should only be used in case of interventions. I personally believe OPD should not be run by a tertiary care or a quaternary care system because there's no need. They can all be done virtually. Doc patient should just walk in for intervention where a surgery is supposed to be done or something like that.
For like a so telehealth is more like a refer or a resolve or refer kind of system, which is more a primary health. Great. So I'm going to take a few questions. We have already had a few questions that have come in, and I encourage participants to put in your questions in the Q&A section and not in the chat section. So the one of the first questions we got was from Pooja, who says, where do we get telemedicine apps certified from, and what kind of certification is needed? This is mostly from who gives a thumbs up on the platform itself.
No, I think there's no specific thumbs ups required. If your team is developing it and then compliances like HIPAA, HL7, all that can be done. And if you are following ISO standards in the backend for the processes, all is fine. Now that guidelines are there to refer to, so it should adhere to that.
And then we have a few questions asking where to find the guidelines. Vikram, if I'm not wrong, it's available on the MCI website. Please go ahead.
It's available on the Ministry of Health and Family Welfare website.
So questions are coming in and moving quickly. I lose my sight on that. So there is one question on interportability of information and patient information from one platform to the other. How do you see that right now? We're looking at
I think there's a one. That's a very simple answer for that. In case that's definitely a challenge today. If we follow standards, we would be ready. All the platforms should have a standard, and it would be ready. But government has to come up with some strict guidelines on that, and then only it's possible. Because otherwise, one hospital system may not be happy sharing data with another hospital system unless government puts its regulations in it.
All right. So interesting question. Somebody here wants to know if dentists are using telehealth at this point.
Yes, teledentistry is, I think, one of the easy and comfortable specialty of telemedicine used globally. Uh, Initially, I think many years back, teledentistry and teledermatology were the top two specialties of telemedicine. So, yes.
So, good. So here there's a person who's setting up their own clinic and wants to know if there is a need for government permission to set up a teleconsulting platform within their hospital.
There's no requirement of a government permission. Now, I think with guidelines there, is just follow the guidelines. And before the guidelines were there, we were following the protocols of the physical system as much as we could. And I believe telehealth is the only way. In a physical doctor setting, we don't record a patient doctor interaction, but in a teleconsult, this is recorded. On an audit, we can tell a doctor that you were not courteous enough, or you were not displaying empathy. From that to telling a doctor that you did not write your prescription in capitals, which is the requirement. So telehealth is much more auditable, and I think hence much more comfortable.
So next question is, I think something that is important and cuts across all things digital. What are the measures in place to ensure patient-provider confidentiality and privacy of information?
Basically, as I said, if you follow certain ISO standards and HIPAA compliances, it's all in place. While data transmission is happening, if your platform is doing data encryption, that's what I said. It's perfectly safe.
So there have been specific questions. Is there tele-psychiatry, tele-ophthalmology? So I'll just kind of summarize and ask, is there a particular specialty which cannot be on telehealth rather than saying what is all there? Because I think there's an enormous list of specialties.
So I think emergency care is something which can be avoided, but we are doing tele-emergency. So we have proven in last 4 years by saving close to 1,200 lives that tele-emergency is also possible. But tele-emergency is little difficult to do. Rest of it, all specialties can be done. If you want to add robotics, telerobotic or telesurgery into surgery, then robotic surgeries from a distance are also covered under telemedicine. Technically, everything can be done.
So another question about how doctors are taking this. In general, what's the feedback from doctors post a series of teleconsultation in a day? How will the prescription be written and sent for the patients?
So prescription is usually written in the doctor login side of the EMR, which is used for teleconsults. So since there are a lot of support given by the clinical decision support system, there is very simple and user-friendly drop-down menus, list of drug database. It's very easy for a doctor to do a prescription writing. They don't really need to stress and remember names, brands, generic medicines are all part of the database. And then it's usually sent to the patient. There are different methods, different platforms use different methods. Some send a SMS and you can download a prescription. Some send you prescription inside your app. But yes, it has to be digitally signed by the doctor, displaying the doctor's name and the registration number.
So we have a participant who talks about having a setup which have patients, disabled patients across India, and they want to set up a tele-doctor consultancy, especially for their needs, which are different than normal, because they're all BPL consult, BPL in the BPL section. So they want to know if free consultancy, how they can set up such a unit.
Basically, the question is a little vague. If they want to set up telemedicine setups, it's very easy. And if it is BPL, there are multiple corporates who are doing CSR. And pre-COVID era, we were doing CSR implementation for many. And during COVID also, I think corporates are coming forth and using their CSR money for healthcare delivery. Very easy. And if the person who wrote the question can directly reach out to me, I can give more support on setting that up for BPL population.
Okay. That's great. Thank you so much for the offer, Vikram. And then, sorry, let me see. Questions are moving fast. I can't read them. Okay. So yeah. So the question was about physical examination of patients while a doctor is consulting with a patient. So how does that work?
So the question is that probably the absence of physical touch, right? Or
Yes,
the
that's right.
diagnostics.
So because physical exam is one of the important aspects of a consultation before prescription or diagnosis. So how is that aspect handled via a teleconsultation?
So, yes, Soumya. So as I explained earlier in one of the slides in the PPT, there are if your platform has a lab module and you have a complete laboratory and the entire test can be done by the patient without doctor being there, and lab technician is the one who sends it into the EMR and doctor is able to see it. Or in case of home health where patient is doing, there are multiple devices for chronic diseases which like connected BP monitors, connected hemoglobin monitors, uh, connected other glucometers, where the data directly goes into EMR and the patient is able, doctor is able to see it. So there are very few cases where a doctor is really hand tied in the absence of diagnostics. There are diagnostics available. In even in even during the COVID times, most of the isolation rooms are relying on temperature and SpO2, which is easily connected to the platform.
Right. So there are, of course, a lot of doctors at this session, and therefore this whole trying to understand how to do the physical absence of physical exam is a big cause of anxiety. So how do we take vitals? Can we prescribe non-OTC drugs without doing a prior physical check? So are there any limitation in terms of guidelines at this point about what can be done over a teleconsult and what cannot be done via teleconsult?
So great. So I urge everyone to read guidelines, not a very tedious task. Made it very easy for doctors to do consults. Except for a particular schedule of drugs, all of the drugs other than OTC also can be prescribed over teleconsult.
So there's this one question about build or buy kind of thing. Should we ideally kind of build a platform for within our own hospital, or should we kind of already take the off the shelf purchase slash lease kind of contracting? What would be your advice? Yeah.
I think depending on the size of the hospital system, if the hospital system is big, then homegrown is what I think is the best option. If it's a doctor clinic or a small hospital or a couple of hospitals as a system, then it's better to take soft platforms from outside, which can be both licensed or it can be pay per use. It can be a software as a service, platform as a service. There are multiple commercial methods used by different platforms.
All right. So this is another question about how patients have received telemedicine. What has been the satisfaction level? What has been the feedback that you've been receiving from the patients about their consults on tele consulting platforms?
So a great question. I think this is the way you finally find what's the adoption. So we from the last 10 years have been doing patient surveys, those who have taken consult, and 98% of the people till now have felt satisfied with the services. 2% people mostly fall under the technical glitches, and not the glitch, not the problem with the doctor or not a problem with anything else. So technical glitch, consult could not finish, consult got dropped, call got dropped, video dropped, or something like that. So I believe patients, specifically rural patients, have been very acceptable to this. Unlike what we thought when I started telemedicine 10 years back here, I thought it would be urban people who will adopt telemedicine better, but I think rural is who adopt it better, use it better, And urban, since they had options to go to a nearest clinic, hospital, probably did not pay attention. I think COVID has changed their point of view today.
All right. So, uh, there's a comment that this will probably reduce physical contact and therefore physical violence against doctors. I don't know if how much of that holds good. It'll be interesting to hear your thoughts on that, Vikram.
I think it's a natural way if you are not physically present, so definitely might reduce violence. But uh, I think violence as itself is not right, and that too with the healthcare providers who have been on the front line even before COVID for helping people. So
All right. So I'm just scrolling to see if there are any other themes that are there that we can pick up. I think the major themes have been about physical consult being absent and how has the adoption been from the side of doctors and the satisfaction level from the patients, limitations of the platform. I think it is very important for everybody to go through the guidelines that have been provided on the government health ministry website before you set up uh, your practices. That will be very critical. And I think I am sorry we have not been able to cover all questions, but I've tried to pick up some of the themes to ask Vikram his opinion about some of these things. Vikram, before we conclude the session, why don't you give three to dos and three not to dos while people set up their own teleconsulting services? So, as a wrap up to the session, please.
oh, great. So I was trying to figure out like if I can pull out some synopsis of the guideline, and because there have been multiple questions around the guidelines. So basically, Soumya, to dos and not to dos, I would summarize. I think to do is basically orient doctors to how to use. They should be onboarded. Uh, Everybody knows that doctors have adopted technology from time to time, right from the days when doctors adopted X-ray as a technology to MRI to CT. This is nothing but technology adoption. Teleconsults is nothing different. So if you orient doctors, very good. They are onboarded, it's fine. Secondly, to do is to keep the system simple, make it user friendly, both from the consumer and the doctor perspective. Very important to do. Uh, Ensure that you are not just doing minimal, but you are doing the right one, which means WhatsApp is a minimal if today someone wants to consult, but it should have an EMR with it. It should have a recording facility because you have to adhere to the guidelines. So that's to do. It should be optimal, not minimal. Not to do is basically as complete. Some of them was completely vice versa. It should not be very complex. Should not be very non-user friendly. The platform in use. Don't try to experiment with everything. Very important. Uh, Even we have experimented with many pilots, many projects, many versions of the platform. Don't try with many. Spend some time in analyzing what you need, what are your needs, how would it serve your business better, which platform will serve your business better. And once that is done, then move to a platform and stick to it for a while. Don't change quickly, don't get dissatisfied. You may bring in the changes in that platform for your use. So that's important. And ensuring that all stakeholders are benefited and are onboarded. If the platform does not make money, they'll not be able to make changes and they'll not be able to add value to your system. If the doctor is not able to make money, they will not give attention to this. So pricing strategies are also important. A teleconsult versus physical consults. For a doctor, it should not be a loss to go on a teleconsult. That's very important. Doctor should equally earn what he would have earned otherwise. And that's, I think, very important. These 6 points which I just put forward.
Thank you so much, Vikram. It was fantastic having you talk about the teleconsulting, big issue that is, I think, on everybody's mind as they are in the during COVID period for the after COVID period. So before we sign off, I'm just going to make announcement of the upcoming sessions. Next week, we are going to have 2 sessions. On Wednesday, 6th May, we are going to be talking about lockdown exit strategy for healthcare organizations. Professor Sarang Dio, who is the Executive Director of Max Institute of Healthcare Management at the Indian School of Business, will be talking to 2 practitioners to understand what has been the priorities, what has been the learnings during the lockdown period, and how the healthcare delivery, care delivery models are going to be emerging post the lockdown. So this is for Wednesday, and the call details are here. Please note down the call details. Otherwise, the call details will also be put up on our showcase page on LinkedIn, Healthcare at ISB. On Saturday, we are going to be talking about idea to market. So we are branching off in 2 kind of themes. One, we will continue to talk about the complexities and the moving pieces during the COVID for management of hospitals and healthcare organizations. And the second theme that is emerging is for us to make sense of the various trends that are happening around digital and innovation in healthcare. So second of these, last week, earlier in the week, we talked about healthcare innovation in times of crisis. And as a run up to that, we're going to be talking about idea to market, healthcare innovation, commercialization, and funding in association with TIDE Chandigarh. Again, the details will be put up on our LinkedIn showcase page, Healthcare at ISB. And this is the QR code. Please follow us and stay connected with us on our LinkedIn page. Thank you so much, Vikram, and thank you everyone for being part of the session. It's been great and very interactive, which is always very nice to hear questions and have them have a very engaging conversation during these webinars. Stay safe and stay connected, and see you all next week during our Wednesday webinar. Bye-bye.
Thank you, everybody. Bye.